The search for a cure for coronavirus is on, and frenetically so. But there are many medicines that are now being slowly tested at various stages of testing. Some results are somewhat positive, some are not. It depends on where those tests are happening. The tests for hydroxychloroquine, for instance, in the United States have not been seen as very successful, but doctors in India who I'm talking to continue to administer it, and with reasonably good results. So the question is, what are the new drugs on the horizon, and will some of them work? One of them is Favipiravir, which is a new or a newer antiviral drug, which is being manufactured by a Mumbai company called LASA Supergenerics, and they've also got approval to proceed with testing. I'm joined now by Omkar Herlekar, the chairman and managing director of the company, to explain to us what this drug is, how it works, and what is it likely to do, or what is it likely to, or how is it likely to work? Mr. Herlekar, thank you very much for joining us.
Yeah. So great. Thank you for, calling me onto your channel. And this Favipiravir, the name of the drug, the subject drug which you are discussing about, is called as Favipiravir. This is basically an old drug. This is not a new drug. This is almost around 18 years old drug, which is being invented by a company in Japan by the name of Fujifilm. Okay, so this is an old drug, and it is an off-patent drug basically. So there are no patent issues also. So this is
right, but this is the first time it's being tried in the case of COVID-19.
Yeah, it is tried here. The efficacy for other diseases like Ebola, Middle East respiratory syndrome, SARS, and many other RNA virus related diseases which had come up. Typically the flu kind of it.
Right.
So this drug has shown a promise. Basically, it works in a little different way. So basically, what a virus does, when a virus enters human body, it basically first of all tries to replicate its own RNA with our human RNA. There is an enzyme present in our cell called as RNA polymerase. So taking the help of this enzyme, this virus makes its copies in our human cells. And then the human cells start behaving as if they are the virus. Actually, it is not a virus, but the human cells start behaving as if it is own virus. Okay, and then it does what it does all the functions what the virus does, and whatever damage it has to cause to the body, it does to the body. Okay, including a lot of many things like pneumonia, cytokine storm, and many more things you are hearing on the thing. So it is nothing but your own body's defense mechanism is fighting against you. So this is what happens. So typically now what happens for a drug like Favipiravir, it directly inhibits this enzyme. Which enzyme? RNA polymerase. So once this enzyme is inhibited, the virus which earlier used to make its Xerox copies in the human body stops making the Xerox copies. So once the Xerox copies are stopped by the virus, the viral load, which is the residual viral load which is present in the body, is drained out of your lymphatic system, and then slowly means in a quick amount of time, the person gets discharged out of the hospital, and that stage comes when the virus load is non-detectable in the body. So this is how this Favipiravir works.
What's your sense in the normal recovery for a patient? How many doses would a patient need or require?
Typically 14 doses.
So if assuming this drug were to work out, there is clearly enough of this drug to meet all the needs?
Take care of the Indian population. It will be enough to take care of the entire Indian population.
Right, and in this drug, of course, is administered along with other drugs. Am I right, or is this the primary drug, or likely to be the primary drug?
This is the primary drug. This is the primary drug. There will be supplementary drugs also, like to mitigate the acidity, acid reflux, to promote the immune system, like vitamin C and all. But this will be the primary. This will be the primary drug.